So far, we have discussed so much about the DECLARE study. So can we, what does it provide to us? Can it provide an insight to the use or management of diabetes? So I would like to summarize the conclusions by a couple of slides drawn from a meta-analysis. So the first SGLT2 inhibitors, no matter it is EMPERAC, CANVAS, or DECLARE, it appears to be the drugs that can really reduce the risk of cardiovascular and renal events, especially heart failure hospitalization and development of renal complications. So this is the second point. SGLT2 inhibitors appear to reduce MACE in patients with type 2 diabetes and established cardiovascular disease only. However, in terms of heart failure hospitalization, it's reduced the risk of heart failure hospitalization regardless the patient has pre-existing cardiovascular disease or without pre-existing cardiovascular disease. Third, how about renal function? So the effects of, it appears that SGLT2 inhibitors reduce MACE rates in patients with normal or abnormal renal function. However, in this meta-analysis, we can see that maybe it is a little bit attenuated in patients with normal renal function. Although, as I said, this is meta-analysis and subgroup analysis, so we have to interpret this with caution. But anyway, it appears that for patients with renal function ranging from less than 60 to less than 90, we can see a benefit in terms of reduction in MACE. So I want to draw your attention to the current guidance about the renal adjusted dose. So for canagliflozin and empagliflozin, it is advised that we should start the drugs only in patients who have a eGFR more than 45. So for dapagliflozin in Hong Kong, currently the approval is still for patients who have a eGFR of more than 60 only, but it will be changed in shortly to include patients also with a eGFR over 45. Nevertheless, if the patient has developed a renal impairment during the treatment and has a eGFR drops below 30, definitely we have to stop the medication.